Hi, good morning. I'm Philip, a staff nurse in Hamad General Hospital, 6 North 1. Today, I'm gonna show you the practical, the easy, the quick neurological assessment that we are doing, the Glasgow Coma Scale or the GCS. The GCS has three components. First, the eye. Second, what the patient say or the verbal. 3, what the muscle do or the motor. And each component is divided to categories or scores. The eye has total score of 4, the verbal has 5, and the motor has 6. Neurological assessment is very important in the hospital, in the daily assessment of our patient. It is widely used in the surgical unit, trauma and emergency unit, and especially monitoring of patient intensive care units. GCS monitoring is very important in assessing the patient. There you can find out if the patient is deteriorating. You will find out if the brain injury of your patient is mild, moderate, and severe. Glasgow Coma Scale has the perfect or the high score of 15, and the lowest score is 3, never 0. You can categorize the brain injury of the patient to mild, moderate, and severe. The mild will range the score from 13 to 15, the moderate will be 9 to 12, and the severe brain injury is from 3 to 8. So 3 to 8 is a very bad condition of the patient. That is a very poor prognosis. And usually the patient having the low GCS like 8 and below, the neurosurgeon or the neurology, they prefer the patient to intubate and put in the mechanical ventilator to avoid more damage to the brain of the patient. After you enter to the patient room, you introduce yourself, you start assessment, take the vital signs, take the neurovital signs of the patient. So if you start the GCS monitoring, you will start with the eye response. Eye response, if you see your patient spontaneously close and open their eyes, so you have the score of 4. And if your patient's eye open through verbal, so you have the score of 3. Eyes open to verbal. And if not, you have to apply here pressure or pain. But we are not intended to hurt the patient. So instead we are using apply pressure. And the eyes of the patient open after you apply pressure. So you have the score of 2. And if the patient eye no response at all, then you put no response or score of 1. And you have to take note, some of the patient sustained severe head injury, including the face, the eyes, the jaw, the mouth, wherein it will interfere or change your assessment of the GCS. For example, the patient had trauma in the face, wherein their eyes is swollen. So in that, you can put unable to assess. The eyes unable to assess or non-testable. So if you will do documentation, make sure you put unable to assess. The next component of the GCS is the verbal. Verbal has a high score of 5. 5 means the patient is fully oriented. You ask questions, simple questions, and they answer correctly, oriented. And if the patient is disoriented, you give the score of 4. You ask simple questions, and they respond wrong answer, disoriented. The next one is inappropriate words. The patient is talking a lot of phrases, combining words, nonsense words, so you give the score of 3. And the next one is incomprehensible sounds. patient's no words at all. The patient just giving you sounds, mumbling, moaning, and that is score of 2. And if no response at all, patient is mute, you give the score of 1. But take note again, assessing the verbal sometimes may have exemption. For example, the patient is intubated, patient have tracheostomy, patient is sedated, especially in the ICU. Patient unventilated, they are sedated. So you instead of putting 1, you put sedated. Instead of putting 1, you put intubated. Okay? Motor response has the highest score of 6. 6 means the patients follow commands. You give simple tasks to the patient and they can follow using the motor of the patients, like, can you grasp my hands? Can you raise your both hands? Can you raise your both feet for me? And the patient follows, the patient move correctly, so that's you have the full high score of 6 in the motor. And if the patient has the score of 5, it means the patient, you call it localized pain, by the way, in the motor. You apply stimulus. In applying stimulus, you can use pinching of the trapezius muscle here, or you can use the suborbital notch. You apply pressure here, and the patient move his hands toward the chin, towards to the stimulus that you apply. So that is score of 5. Next is the score of 4 in motor. If the patient has normal flexion, you apply again pressure or light pain, gentle pain, and the patient normally flex. That is normal flexion. Score of 4. And for the score of 3, we call it decorticate or abnormal flexion. Again, you apply pressure, you apply gentle pain, then the patient arm inward rotation, and the foot, both feet plantar flexion. Okay, so that is decorticate. And the opposite, you have the score of 2, is the decerebrate. Decerebrate is abnormal extension of the arm. So you apply pressure here or here, and then after the patient feel the pain, abnormal extension of the arm plus plantar flexion. So that is the decerebrate or the abnormal extension of the arm. 5, 6, 7, 8. And if the patient doesn't have response at all after you give pain, sometimes you use the external rub using your knuckles here or here and doesn't move, no reaction, so you score of 1. That is placid. But of course, exemption, patient is sedated, of course patient will not move, and patient is paralyzed, of course, so you have to check the background of the patient, the past medical history of the patient. Patient is paralyzed, patient have motor neuron disease long time ago, so you have to consider that. So that's all for today. That's all about Glasgow Coma Scale Assessment. If you find this video useful for you, or if you have any questions, clarification, you can approach the UBC members, the educational group in AMU 1, 6 North 1, and you can approach our head nurse, Ma'am Rose, if you want to discuss some important topics that you like. Okay? Thank you. Masalam.